Usual interstitial pneumonia is a form of lung disease characterized by progressive scarring of both lungs. The scarring involves the supporting framework of the lung. UIP is thus classified as a form of interstitial lung disease. The term usual refers to the fact that UIP is the most common form of interstitial fibrosis. Pneumonia indicates lung abnormality, which includes fibrosis and inflammation, a term previously used for UIP in the British literature as cryptogenic fibrosing alveolitis, a term that has fallen out of favour since the basic underlying pathology is now thought to be fibrosis, not inflammation. Causes. The cause of the scarring in UIP may be known or unknown. Examples of known causes of UIP include systemic sclerosis, scleroderma, rheumatoid arthritis, asbestosis, and chronic nitrofurantoin toxicity. Symptoms. The typical symptoms of UIP are progressive shortness of breath and cough for a period of months. In some patients, UIP is diagnosed only when a more acute disease supervenes and brings the patient to medical attention. Diagnosis. UIP may be diagnosed by a radiologist using computed tomography scan of the chest, or by a pathologist using tissue obtained by a lung biopsy. The histologic hallmarks of UIP, as seen in lung tissue under a microscope by a pathologist, are interstitial fibrosis in a patchwork pattern, honeycomb change and fibroblast foci. Pathological findings in usual interstitial pneumonia. Appearance of usual interstitial pneumonia in a surgical lung biopsy at low magnification. The tissue is stained with hematoxylin and eosin to make it visible. The pink areas in this picture represent lung fibrosis. Note the patchwork pattern of the fibrosis. Appearance of honeycomb change in a surgical lung biopsy at low magnification. The dilated spaces seen here are filled with mucin. Hematoxylin eosin stain, low magnification. A fibroblast focus in a surgical lung biopsy of UIP. Hematoxylin eosin stain, high magnification. The white space to the left is an airspace. The pale area to the right is a fibroblast focus. It is an area of active fibroblast proliferation within the interstitium of the lung. Differential diagnosis. The differential diagnosis includes other types of lung disease that cause similar symptoms and show similar abnormalities on chest radiographs. Some of these diseases cause fibrosis, scarring or honeycomb change. The most common considerations include chronic hypersensitivity pneumonitis, non-specific interstitial pneumonia, sarcoidosis, pulmonary Langerhans cell histiocytosis, asbestosis. Prognosis. Regardless of etiology, UIP is relentlessly progressive, usually leading to respiratory failure and death. Some patients do well for a prolonged period of time, but then deteriorate rapidly because of a superimposed acute illness. The outlook for long-term survival is poor. In most studies, the median survival is 3 to 4 years. Patients with UIP in the setting of rheumatoid arthritis have a slightly better prognosis than UIP without a known cause. History. UIP, as a term, first appeared in the pathology literature. It was coined by Avril Abraham Lebo.